19th of June. A manager from that restaurant, that club, I understand they've been in the media already this morning identifying themselves, and then 2 further close contacts of that case. The fact that all of these cases were in hotel quarantine is a credit to our contact tracers who've done a fantastic job, and our hotel quarantine services, and of course all of those people who come forward as contacts of cases. They do a service to the community by keeping the community safe and staying in hotel quarantine. Those 4 cases mean we now have 39 active cases. Our total number since the pandemic began more than 511 days ago is 1,677. We continue to test more than 10,000 tests in the past 24 hours. Our vaccination rate remains high, 13,985 in the last 24 hours, bringing us to 477,000 total vaccines administered here in Queensland. Of course, we remain very concerned about the emerging situation in Sydney, the Delta variant outbreak in Sydney. What we've seen with some of the cases there is that it is highly, highly infectious. Fleeting contacts of 5 to 10 seconds can result in infection. That means you only have to be in the same breathing space as someone with this variant to risk contracting it. I noted that the New South Wales Health Minister, Brad Hazzard, somebody I worked with very closely, said he was as concerned now as he has been at any point during this pandemic, and that means we are concerned. We are monitoring it very, very closely. It's important that anyone who is sick gets tested, but in particular anyone who has been in Sydney. This outbreak really could test all of our systems, everything that we have developed over this pandemic, and so it's incredibly important that we get this right. The new restrictions for people who've been in Sydney came into effect in Queensland at 1 a.m. this morning. That means non-Queensland residents who've been in Greater Sydney, Central Coast, Blue Mountains, Wollongong and Shell Harbour cannot enter Queensland. Queenslanders who've been in those locations will need to go into hotel quarantine. Police have been meeting flights at our airports this morning and turning people around, and so we would like to send a message to anyone in Sydney who is thinking of coming up to Queensland. Please don't. We have asked the airlines to provide alerts at Sydney Airport, but we really want to get this message across that if you fly into Brisbane or the Gold Coast this morning and you're not permitted to enter, you will be turned around. If you're a Queensland resident, you will go into hotel quarantine. I understand on the first flight that arrived alone, there was 120 passengers, 20 of them were sent back to Sydney. So it's incredibly important that anyone thinking of coming up understand what the rules, what those rules are. We're also urging Queenslanders to take up the opportunity that will come with some cancelled bookings. We know that on the Gold and Sunshine Coast, for example, 20 to 25% of bookings for the weekend and the early school holidays could well be cancelled, and that is a chance for Queenslanders who've not yet booked their holidays to please consider the Gold and Sunshine Coast. Similarly, the number of people from Sydney who had planned to travel up for State of Origin on Sunday means that our CBD hotels will be experiencing cancellations. We expect somewhere up to 40% of hotel rooms that were booked this weekend could now become vacant. So that's a chance for anyone who might not have had plans to stay overnight after the Origin or who want to have a weekend in town. This is a great opportunity to book a CBD CBD hotel, and that's one way we can all help out our local economy. I might ask the Chief Health Officer.
Thank you very much, Deputy Premier. So 4 new cases in Queensland overnight, 3 of them community acquired, 1 of them acquired overseas. The 3 community acquired cases are all related to that woman who came from Portugal. One of them is the manager of the Portuguese restaurant where that woman attended, and I want to personally thank him for all his assistance. Due to his cooperation and the work he's done with us, we were able to get all of the people who attended that restaurant rapidly into quarantine, and he's one of those people who's contracted the infection. Then 2 other people, he went into home quarantine. Then we have 2 other people who were travelling with that lady from Portugal when she was out and about in Brisbane on that Sunday. So that's not surprising that they've become infected. They went back into hotel quarantine, so they've been there their entire infectious period. So I'm not concerned that any of these 3 cases are a risk to the Queensland community, and I'm not concerned with that outbreak in that we now do have everyone in quarantine that we believe was at risk. Now we have to remember that was the Alpha variant, so far less infectious than this new variant that we're seeing circulating in Sydney, the Delta variant. We have seen how rapidly, in just 1 week, that has taken off in Sydney, and we have to be so alert. So please, everyone in Queensland, we don't know how this might get into our state. I know we're really good at managing our borders and that people are really good at adhering to all of those requirements, but it is important. If you have any symptoms at all, please come forward and get tested. We had around 10,000 Queenslanders do exactly that yesterday, and thank you to every single one of them. We must keep that going. Now, at this point in time, the outbreak is restricted to Greater Sydney, so that's why those restrictions have been put in place at the border from 1 a.m. this morning to that Greater Sydney and the surrounding areas, and that's really important. But we don't know what's going to happen going forward. We know that people in Greater Sydney could, of course, leave and go to regional New South Wales. Sydney has said that the people living in those key 7 eastern suburbs can't leave those suburbs except for essential reasons, but other people can. So it is really important that people take that into consideration if they're making any plans at all to go down to New South Wales. This could rapidly escalate. New South Wales has a very, very good sewerage detection program in place, and I get that data every single morning, so I can report this morning there have been no detections in the sewerage outside of Greater Metropolitan Sydney, none in regional areas, so that is really good, particularly that northern area, but that could change. So I strongly recommend that anyone in Queensland, unless you have an urgent, unavoidable reason, this is not the time to go down into New South Wales. You could end up exposing yourself and putting yourself at risk, particularly given where we are with our vaccine rollout. So we're doing a great job there, given the amount of vaccine that we're able to get from the Commonwealth, and we're using all of that vaccine. It is very, very important, more important than ever, that people who are in their target groups at this stage, come forward and get vaccinated. I need all of those 1A and 1B people to be vaccinated. They are absolutely critical. And then we need older people because they are most at risk if they get infected. So at the moment, if you are 40 plus, you can get vaccinated, but I really stress it's that 60 plus group that is very important to get vaccinated.
Given what's happening in New South Wales, and I understand what more than 30 new cases today, are you concerned that all those came in before 1 o'clock this morning? What happens to them?
Right. Anyone who's come in before 1 o'clock, New South Wales has been excellent at putting out all their exposure sites. That has been really important. And if anyone has been to any of those exposure sites, they immediately need to let us know. They shouldn't be travelling, but sometimes, of course, you don't know about the exposure site till you've already travelled. So anyone who has been anywhere in New South Wales or the ACT in the last 14 days, please immediately go online and just check that you haven't been in an exposure site. If you have been, you need to immediately get yourself tested, isolate yourself, and either ring 13 Health or go online through the portal, as thousands of people already have, to fill out that information, and then we'll contact you.
Do we know how many people could have arrived into Queensland before 1 a.m. this morning and been in Sydney since this outbreak began?
We do have that data, but I don't have it on me. I'm sure we can get it. Yes.
When did they go into
On
after she tested positive?
Yes, the close contacts, we contacted all of them at 10 to 8 on that Saturday afternoon, because they were only a small group that had been going around with her. So they were very promptly put into hotel quarantine. The people who attended the Portuguese restaurant, it was through the next day, lunchtime, early afternoon, that they went into quarantine.
When you say going around, do you mean Brisbane?
In Brisbane. So remember, they went to the DFO and then they went to the city, and they were here in the CBD. That time of risk really has now passed. But it is really, really important, thank you for mentioning it, that anyone who was in the CBD between 5 and 6 p.m. last Saturday, any symptoms at all, even the hint of a symptom, please come forward and get tested.
Any idea of how long your outbreaks have been?
No, it's far too soon. We're still on that part of the curve. We're going up. The good thing is that we can see that Melbourne has come right down. So with all of these outbreaks, they have a curve. They're in the up curve, and then you can see them come in the down curve.
There's still a chance we hold on the same position.
Yes, absolutely. That is why I'm really, really strongly messaging, as strongly as I've ever done, that people should reconsider their need to travel anywhere in New South Wales.
Can you explain what rules they'll have to follow out there?
Right, so I understand that, New South Wales, despite all that's been going on for them down there, have been working very closely with us, and I understand that the charter flight has been organised for around lunchtime today to fly up to the Gold Coast. Then we're just working with the Gold Coast to move his parents from Robina up to the Gold Coast Hospital, which is one of our 5 networked COVID hospitals, so we can manage that all very carefully. And they'll be seeing their parents-in-law in the Gold Coast University Hospital.
Is that the new process going?
No, so that at the moment is what is happening, and we'll treat anyone similar to that circumstance as an individual case, and we'll look at the situation. Each case is so different.
And will Mark and his wife, will it be a sort of full PPE going into visit type scenario?
They'll be working through, the hospital will work through with them to maintain some distance, because I'm positive that he does not want to potentially give his father or his mother COVID. So we'll work all that through with them to make sure that it's done as safely as it can possibly be done.
Actually be able to hug. It may
That's
be a
correct.
visit from a distance.
Yes, yeah. So they'll work that through. Oh no, they'll go into the room, but they'll sort that out, because I'm positive that, because the risk then, if they give it to one of their parents then will have difficulty seeing their other children. There's so many complexities here, but we'll work through all of them. And their quarantine period is close to coming to its end anyway. At this point, yes, we'll keep a very close eye on what's happening, of course, in terms of people coming into Queensland, but we've already seen that the numbers have they've dropped enormously.
The outbreak is evolved in its severity and seriousness compared to other outbreaks
Oh, it's,
given the
yeah, I'm as concerned, much like Minister Hazzard, as I've ever been, but I'm also confident that we have got really good systems in place. I'm so grateful, glad that this variant wasn't the first variant we had to deal with. So we've had 18 months of experience in dealing with this, and our community, although I'm sure they're extraordinarily tired of this, it's been going on for so long, our community across Queensland knows exactly what to do. Just to have gone out and messaged, please, people come forward and get tested, and to see those numbers skyrocket is fantastic. So I'm very confident we know what to do. I'm very confident our community knows what to do. We'll have to draw on all of that strength and resilience going forward.
On that medical case you mentioned yesterday, do we have any more idea of what's occurred?
Which case, sorry?
The transfer between 2 people, level 5.
On level 5, no, but I'm sure that's just a corridor issue. So they were in adjacent rooms on floor 5, and we know that is a risk, and we know that the Delta variant is more contagious. So it'll be something like they've opened the door to the corridor, and then the next room has opened, breathed the same air. We know that's a risk, and I'm sure that's what we'll find, but we're still doing the investigation. We test on day 12 so that we can get the result back before they leave.
Can I ask a question to the Deputy Premier? Deputy Premier, obviously I know you'll be across this as Deputy Premier and as a former Health Minister. Can you tell us why the government is hiding ambulance wait times data?
We very regularly release all of our hospital and health service performance data. In fact, the Health Minister launched a new website just last week.
There's a question I noticed about ambulance wait times. Specifically, October to April, the government published a link which referred back to the website data, which hasn't been updated since last year, back when you were Health Minister. So he said, why are they hiding? We
very regularly release health performance data for right across the system, including for the ambulance service.
But it's not. We've got these, I'd suggest maybe it's because of these operations briefs which we've been given, which paint a frightening picture of one night, over 100 cases waiting, up to 20 code 1s waiting, some patients waiting 17 hours, and more than a dozen crews down as well. I mean, is this why the figures aren't coming in? Is this what is being hidden?
Well, look, I'm happy to look at the documents that you've got there, but I know that our AMBOs do a fantastic job taking care of people in the community, and if you look particularly at code 1A cases, the most urgent cases, they respond very quickly.
They do. I mean, we've got crews down here everywhere. Crews down one night, Narangba, Redcliffe, North Lakes, Northgate, Roma Street, Spring Hill, Kenmore, Chermside, Alphabet, Nathan, Sunnybank, South Brisbane, Centennial.
Tim, I get that this is more for this camera than for me, but thank you. I'm happy to have a look at it, and I'm happy to respond, but I'm telling you that we have a fantastic ambulance service. Our paramedics do a fantastic job, and I support them.
They are fantastic.
I think you've had your go, Tim. Lydia?
We don't have any like water blocks. The Premier mentioned yesterday she made blocks and patrols. Given that this is so serious in New South Wales, do we need to bring back the blocks?
Not at this stage, but obviously that's something that will be under active consideration over coming days. I think the Chief Health Officer has just outlined how concerning it is coming into school holidays, that people from Sydney outside of those LGAs that have restricted movements could well be holidaying in northern New South Wales alongside Queenslanders. It's one of the concerns coming into this weekend and into the school holidays, and that might require additional border restrictions down the track. We just put in place that new border pass arrangement, which will assist greatly. But I think we just underline that this is going to play out over coming days, and we'd encourage Queenslanders to stay in Queensland, and we've I think sent that message now that anyone who's in Sydney who's not a Queensland resident should please stay there. Well, we've certainly turned people around at the airport. I'm unaware of whether they've intercepted anyone at the border. They are ramping up those patrols, those random checks, and so people really shouldn't be trying to get around them. We've got this far this well because people have complied by and large with the rules, and we'd certainly urge people to comply with them. Here there are and will be penalties if people breach them, but we'd obviously prefer that people voluntarily comply.
Is there any concern about the New South Wales origin team? I understand they've been at Kingston.
No, there's no concern at this stage. Oh yes, if they've been to an exposure site, they wouldn't be able to come to Queensland, but I understand the NRL is very, very practised at this. They've been doing it for 18 months. They've been doing it really well. They've already checked that none of them are at risk, yes.
Sorry to get aggressive, is there any update in terms of how that initial transmission happened with that first?
Yeah. We are becoming more confident that it is that quarantine worker that transmitted the virus as a fomite. So the virus was on them and they transmitted it between one of those cases who were positive from Mongolia to the case who came to us from Portugal. So we're pretty confident that's what's occurred. The investigation hasn't finished, but after looking at CCTV footage, we think that happened.
Is that a hotel staff member or a quarantine?
No, it's a quarantine worker. The hotel staff did not have anything to do with that transmission. I'm extraordinarily grateful to the hotel and the assistance they've given us.
Thank you.